Today I'm on site at Women's Imaging Center at Edward-Elmhurst Health. We'll go inside and learn about the latest in imaging technology. I'll be speaking with Dr. Darius Gilvitas. He's a diagnostic radiologist with Naperville Radiologists, and he's also the medical director of breast imaging at Edward Hospital. We'll meet Lisa Garcia. She's the supervisor of radiology at Edward Hospital Women's Imaging Center. Let's start with a big overview of what the Women's Imaging Centers do here and all the services that you offer women.
So we provide mammography, breast ultrasound, stereotactic breast biopsy, ultrasound-guided biopsies, and breast MRI, as well as bone densitometry.
And the neat thing is that Edward is offering women an opportunity to come in here without needing to see a doctor first or their prescription. How does that start? What's the process?
So we are now offering no-order mammograms. So any patient can come in and get a screening mammogram. As long as they're asymptomatic, they don't have any current issues, never had a history of breast cancer, they can come in and get their mammogram. We just require that they give us a name of their primary care physician because they need a physician to get the results.
There's a little fear that comes with getting a mammogram done, and it's nice to see friendly faces. So, like yourself, I'm sure you're very warm. So, when a woman comes in there, how do you minimize that fear a little bit for her?
Well, all of our technologists are educated in, providing extra compassion to the patients. A lot of the patients come here scared and, afraid of the unknown. So, my technologists have a lot of experience with easing patients' fears.
Not all mammograms and not all facilities are the same. What makes Edward stand out?
We go above and beyond, and we have obtained the Breast Imaging Center of Excellence, and we also have an accreditation through the NAPBC, which most area hospitals do not have.
That's excellent. We hear a lot about whether or not women should be getting mammograms these days. What are you telling people?
Well, we follow the American College of Radiology guidelines, and that women who are asymptomatic, who are at an average risk, they should start getting mammograms at the age of 40 or older. If they are at higher risk, then they should start prior to the age of 40.
So I think some of the anxiety that comes with getting a mammogram is a little bit waiting to hear hopefully that good news that
Right.
everything is negative.
Because of that, we started a program where we provide same-day results. As long as the patient schedules their appointment prior to 2 p.m. and they're signed up with our online registration, they will get the results by 6 o'clock in the evening via the online website.
So after the images are taken, what happens next?
So no matter what location the patient has their mammogram, the images are sent digitally to Edward Hospital, and they're read by a board-certified radiologist who is specialized in breast imaging.
So why is it so important that a mammogram be read by an accredited radiologist like yours?
Well, we're differentiated from other area hospitals because we have dedicated radiologists who have specific training in breast imaging, and they read tens of thousands of mammograms a year.
Excellent. Lisa, thanks for taking time out of your day to share a little bit about what you do, and it's so important, and your staff and you just bring such warmth, so I appreciate it.
Great, no problem.
Nice to meet you.
Nice to meet you, thank you.
So let's start by hearing about the new technology for the 3D mammography.
This new technology has allowed us to eliminate one of the greatest limitations of mammography, and that is being able to see through dense breast tissue. 3D mammography has replaced and progressed upon two-dimensional mammography by allowing a radiologist to look through breast tissue. This works by taking thin images with low-dose radiation through the breast tissue. This is very much akin to a CT scan in comparison to a plain chest radiograph. Instead of just looking at something in 2 dimensions, we're actually able to see through it and around objects to help eliminate dense breast tissue obscuring suspicious lesions.
And many women have had the traditional one and know that procedure. How is this different? Does it take more time? Is it more comfortable, less comfortable?
That's a great question. The perception of the exam is actually very much unchanged from the patient's perspective. It's a similar looking equipment. You still have to have the breast in compression for optimal imaging. The only change in a three-dimensional mammogram versus a two-dimensional mammogram is that the imaging head actually sweeps in an arc to take the multiple images.
And who should have this latest technology, or will it all move to this latest technology?
Well, fortunately, here at Edward Hospital, we put a priority on imaging technology and advancements. I'm very proud to work here that we do put a priority on patients' care through technology. I believe that all women should have 3D mammography because the benefits are so clear and so great over normal two-dimensional mammography. Having said that, at a minimum, any woman who has dense breast tissue or a strong family history of breast cancer certainly should undergo three-dimensional tomosynthesis imaging. I'm very proud that we are breaking down all barriers and allowing women to have easier access to better health care, including digital three-dimensional tomosynthesis mammography. It's very simple to come up with excuses on why they don't want to have a mammogram done. Too busy, don't have a prescription, I have other things going on. But by eliminating those excuses, we want to encourage people to come in because mammography is the single modality that has shown to reduce mortality through the increased detection of breast cancer.
Well, and being a woman, having had one done, there's lots of excuses, but there's also a little bit of fear of the unknown, fear of what could be detected. And how does your team and how do you work through that?
That's great, and that's a great question. We do have an excellent team that helps patients through this entire process. I want to start off by saying that early detection cannot be emphasized enough. If breast cancer is detected early enough, there is a 95% survival rate at 5 years. That is outstanding. Second of all, if it is unfortunate to have detected something, using better equipment like our 3D tomosynthesis allows us to find breast cancers at their earliest stages before they have become more advanced. And the earlier we detect something, the easier and more successful the treatment is. We also have a strong team in place, including nurse navigators here, that will take the patient through the entire process, from the discussion of the need to a biopsy, to having the biopsy done right here in our department, to coming back to our breast results clinic, where they will receive both negative and positive results. After that, we help implement appropriate follow-up care, including with breast surgeons as well as oncologists, so that they are taken care of from the detection, diagnosis, to follow-up care. There's always someone here to help through that process, and there's always someone that you can call to get an answer.
Yeah, I think that's so important because you need to have the full circle, and you guys have the full circle. Thanks so much for taking time out of your busy day.
It's absolutely my pleasure.
To talk with us.
Thank you for coming.
That. Nice to meet you.
You too.